Which is next on the list from the folks at PolitiFact in terms of the facts people should know. Everyone will have to have health insurance or pay a fine. It's a requirement known as an individual mandate. I think people in Washington, lawmakers, throw around terms assuming that people know what they mean when in fact that's not the case. Single payer, public option, and so forth. It's part of your lexicon, and I'm not saying this in a critical way of Secretary Sebelius, but I just don't think that's filtered down yet to the rest of us.
Well, I think the way, if you think about the framework, it is a sense of responsibility that everybody needs to be part of the insurance pool. So the poorest Americans are provided coverage with Medicaid, the state-federal partnership for healthcare services that exists all over the country and is really run by states. The lower working families, middle-income families get some help with subsidies for either employer-based coverage or individual coverage, and then employers get some help to stay in the marketplace, stabilize the marketplace. Older Americans are Medicare eligible, so it's a range of programs and services. The vast middle is the private marketplace, but it's anticipated that we need people, if you change the insurance rules, which this does, saying insurance companies must cover Americans with pre-existing conditions, must cover the kind of treatments people need, then you need everybody in the pool to make that work.
Secretary Kathleen Sebelius is in studio with me. I'm Michael Smerconish, toll free at 877-434-1776. Hey Steve, quickly for the Secretary, go ahead, sir.
Comment on if you, for whatever reason, you don't buy into the healthcare insurance, that the IRS may hold your refund check and penalty.
Yeah, please talk about the role of the IRS. It's one of those recurring questions that I get from listeners.
I think the way this is, again, this does not kick in until 2014, so the regs are not written. I don't think the entire plan is determined, but there will be an individual responsibility feature of this. So either you will have health insurance provided by your employer, or you will have an option to purchase insurance through a new marketplace, a new health insurance exchange. For those below a certain income, there'll be some tax breaks, some help doing that. If you indeed have an income hardship, there'll be a waiver. That's much a part of the plan, but there will be a penalty if you don't meet any of those criteria for not purchasing the coverage. But the specific rules of how that's going to work and what exactly that means have not been fleshed out at this point.
To the extent that I hear assertions by the police role, for lack of a better descriptor, Madam Secretary, about the IRS, it can't be true because it's not yet been worked out. Is that what I hear you saying?
Yeah, that's absolutely true. That first of all, this doesn't even, the new marketplace doesn't even kick in until 2014, 4 years from now. Rules and regs are a long way from being written, and the precise determination of what exactly the penalties will be, what the threshold will be that people can opt out, has not yet been fully ironed out.
Joe is in Savannah, Georgia. Joseph, quickly for Madam Secretary, go ahead. Madam Secretary?
Well, I think, Joe, that's a great question, and actually I would say that small business owners, middle-class families are likely to be the big winners under this in terms of what's going to happen. A lot of people right now are really squeezed in the insurance marketplace because they don't have a lot of choices. There's not a lot of competition, and the smaller you are in terms of employees, the less bargaining power you have. That's going to change, putting people in bigger pools, making companies compete for your business, changing the rules so you don't get penalized with a pre-existing condition, making sure insurance companies actually have to use most of their money to pay health benefits. There will be tax credits available to small employers to help purchase coverage for their employees, and the only new revenues that come in are really from people who make above $200,000, $250,000 as a couple, and typically that's on unearned income where they draw down Medicare services but they're not paying into the Medicare program. So the tax addition is really on upper income, a small fraction of Americans will pay for it, but I think there'll be an enormous amount of benefits that will come to people, whether you have insurance or not. If you have insurance, your plan gets more stable. Insurance companies can't boot you out or kick you out or penalize you if you're in the middle of a health treatment. Overhead costs get slimmer. There'll be ways to compare prices, more regulation. So I think there's a lot of good news coming from middle-class Americans.
The folks at PolitiFact.com, top 5 lies. 1, it bans private insurance in favor of a government-run plan.
Absolutely false.
Number 2, preventive care saves the whole health care system money.
Well, I think that is true, that preventive care will actually save money. It's not credited by the Congressional Budget Office as a saving, but no question, if you intervene earlier and get people in healthier shape, it's a lot cheaper to keep people healthy than to pay for sickness.
Another of the lies, according to PolitiFact, bureaucrats will dictate treatment for patients or tell you what insurance plan you have to buy.
Both are totally false, and ironically, Michael, right now, insurance companies often stand between you and your doctor. The doctor recommends a certain drug. The insurance company says, we're not going to pay for it. Recommends a treatment. I, as an insurance commissioner, saw this day in and day out. People fighting with their companies to get the benefits that they paid for and that the doctor recommends. That's one of the things we did. This, I think, puts tools back in the hands of a lot of patients and doctors, which is one of the reasons that the doctors in America supported health reform.
This is Todd. He's in Delaware for Secretary Sebelius. Go ahead, Todd, quickly, please.
Well, actually, the reason that there is some individual responsibility required is just the situation you described, that we don't want a situation where people only come into the market when they're sick and then drop out and drop in again. My experience, though, Todd, is that most folks I talk to actually want to have insurance coverage, want that security for themselves and their families. They just can't afford it or often can't find coverage for sometimes their pre-existing conditions. So we're hopeful that over time this marketplace will actually stabilize people's policies, make it clear that there is some health security, make it easier for people to come in, and then there'll be a sense of individual responsibility. In Massachusetts, where this marketplace exists, with a relatively modest fine but an open market and a change in rules, about 97% of the citizens immediately came in and took advantage of the open insurance coverage.
We have only a minute left together. Wish we had more time. Wipe the slate clean, new subject. I have to ask you, as the former governor of Kansas, Westboro Baptist Church from Topeka, wow, what a disgrace. And what they do to these military families. I assume you're rooting for Al Snyder before the Supreme Court of the United States?
Well, I was thrilled that Mr. Snyder brought that lawsuit. I certainly am rooting for him. I think the role that the Patriot Guard has played, which began in Kansas and now is all over the country, putting a sound and physical barrier between the hate speech of the Westboro Baptist Church and the families of grieving soldiers. I, as Commander-in-Chief of the National Guard, went to funerals all over Kansas, and what they are doing is totally disgraceful. And I am appalled every time I think about the fact that families, in addition to having a son or daughter who is sacrificed and served, have to put up with someone who is disgracing their opportunity to mourn and bring some closure. It is really unacceptable.
It's an honor for me to have you in studio. Please come back. Secretary Sebelius, I appreciate your time here today.
Great to be with you.
Kathleen Sebelius. I'm Michael Smerconish. Looking forward to tomorrow.